We're here to give an update on COVID-19 and our plan to vaccinate more Oregonians. I'm joined virtually by Pat Allen, Director of the Oregon Health Authority, General Michael Stencil, the Adjutant General of the National Guard, Trent Green, Chief Operating Officer of Legacy Health. I do want to start out the afternoon by addressing the news of the federal government's vaccine reserve, which we have now discovered doesn't actually exist. I first learned of this disturbing news yesterday when the Oregon Health Authority discovered there were no additional doses available for allocation in the federal Tiberius system that allocates vaccines to the states. This was certainly shocking for our teams, as just a few days earlier, we, like the rest of the country, heard HHS Secretary Azar's announcement that the federal government was releasing the entire federal supply to help the states expedite vaccinations. As a result, we quickly began adjusting our distribution plans to accommodate the increased shipments of vaccines that were promised to arrive from the national stockpile next week. Then last night, Director Allen and I called General Perna of Operation Warp Speed to track down some more information. That's when he confirmed directly to us that states would not be receiving any increased shipments of vaccines. Despite clear statements just a couple of days earlier, he said there were actually no extra vaccines sitting on their shelves. Let me be very clear. This is deception on a national scale. The arrival of the first COVID-19 vaccines in Oregon last month brought much needed excitement and hope for all of us. Hope for our economies, hope for our communities that have borne such hardships from the pandemic. We all long for better days ahead. And with each vaccination, we are certainly one step closer to that goal. I am shocked and appalled that the federal government would set an expectation with the American people on which they knew they could not deliver with such grave consequences. Upon hearing the news of increased vaccines coming our way, we immediately adjusted our plans to open up vaccination eligibility to Oregonians over 65. I'm certainly demanding answers from the Trump administration. Their empty promises are literally playing with people's lives. So many of Oregon's seniors have spent the past year separated from their children and their grandchildren, and certainly we're eager to hear that additional life-saving vaccines were headed to the states for them. Here's what I will say. While the Trump administration pulled the rug out from under us like a cruel joke, let me assure you that Oregon's priorities and my priorities have not changed. I remain committed to vaccinating our seniors quickly, but this failure by the Trump administration will unfortunately cause a 2-week delay in beginning vaccinations for seniors. Additionally, being supplied less vaccine than promised forces some difficult choices. Beginning on February 8th, we will start vaccinating our most vulnerable seniors, those age 80 years and older. Our experience shows that this group has among the highest mortality rates. And as we're adjusting to this news, we must return to the schedule and prioritization we had put in place before this week's empty promises. The good news is that we have significantly increased the number of vaccinations delivered per day. As I've said for months, one of my main priorities is getting our kids back to in-person instruction in the classroom and to protect our educational staff to help achieve this goal. Starting the week of January 25th, we will begin vaccinations of our educators and school staff. And in some counties, this may start even sooner. Today's press conference was intended to be an opportunity for us to lay out the plan in which we were going to embrace the surge of vaccine doses headed our way and vaccinate more Oregonians. While we know now that a surge is not coming, we would still like to share our Oregon plan with you. Last week, I directed the Oregon Health Authority to speed up our efforts and reach the benchmark of 12,000 vaccinations administered each day. I gave them 2 weeks to achieve that goal, and the Oregon Health Authority has delivered. On January 8th, we hit that 12,000 mark. Today, Oregon added more than 26 vaccines administered to our registry. OHA has been working with healthcare providers, hospitals, pharmacies, local public health partners, and our National Guard to streamline the distribution process and vaccinate Oregonians more quickly. Across the state, we continue to vaccinate Oregon's frontline healthcare workers, individuals with intellectual and developmental disabilities and their caregivers, long-term care residents and staff, and more. Everyone is stepping up, and as a result, we're making really good progress. I'm pleased to see that so many Oregonians are eager to get these safe and effective vaccines. Thank you, OHA. Thank you to our National Guard. And thank you to our healthcare community for working at lightning speed to vaccinate Oregonians. But this is just the beginning. We will remain laser focused as we prepare to continue to scale up our efforts. Soon, we will have a strong, competent, and trustworthy partner we can work with at the federal level. Just yesterday, the Biden-Harris administration announced a much-needed $1.9 trillion coronavirus relief package. I very much look forward to working with them and with Congress on getting this groundbreaking, much-needed package across the finish line. And with that, I'm going to turn it over to Director Allen and General Stencil to go into more details about our plan. Over to you, Director Allen.
Thank you, Governor Brown. This afternoon, I want to give you an update on how we ramped up to reach Governor Brown's target of 12,000 vaccinations and our plans to sustain that effort as we move forward. The actions we announced last week have begun to pay off, and we passed 12,000 doses administered in a day on Friday, January 8th. We've administered over 12,000 doses each of Tuesday and Wednesday, and expect Thursday to total over 12,000 when all reports are in. I also want to tell you how we plan to offer vaccinations to educators and people over 65, despite our disappointment that the federal government has told us they cannot deliver on the doses they've promised Oregon. We've seen how chaotic the expansion of vaccinations has been to seniors in other states. We're taking steps to anticipate and mitigate similar challenges here, though it's a very large population, and I anticipate it will still be a difficult rollout. We're going to take a different approach that stays true to our strategy to prioritize the hardest hit and most at risk based on data. But the approach we take completely depends on Oregon getting a reliable supply of doses from the federal government. In addition, I want to share some new tools Oregonians can use to learn when they can expect to be vaccinated and where they can go to get immunized. I'll also tell you how many doses we currently expect from the federal government and how we intend to allocate them in coming weeks and months to finish vaccinating healthcare workers and people in long-term care facilities, along with educators and seniors. And please hear this. I want to underscore the importance of keeping our commitment to priority communities in Phase 1A, especially people with intellectual and developmental disabilities. First, I want to echo Governor Brown's disappointment that the federal government is not actually able to provide the additional doses Secretary Azar pledged earlier this week. In Oregon, we had expected to receive about 200,000 doses, which would have sped the vaccinations of educators and seniors. I wrote Secretary Azar last night to tell him how troubled I am by this development and to ask Health and Human Services to clarify the situation. So far, I haven't received a response. While I'm deeply disappointed to learn the federal government apparently does not actually have the reserve Secretary Azar promised, we intend to fulfill our commitment to educators and seniors. However, we will need to adjust our timelines. More on that in a minute. Now, let me give you an update on our latest numbers. Today, Oregon added a total of 26,936 additional COVID-19 vaccinations to the state's vaccine registry. Of that total, 10,618 first and second doses were reported administered yesterday, and that total will grow as additional vaccinations that occurred on January 14th are reported to the registry. Oregon vaccination sites in total have administered 173,073 first and second doses of COVID-19 vaccines. Based on today's report, Oregon ranks tied for 24th in the nation in vaccines administered at 39%. The national average is 36%. We're ahead of all our surrounding neighbors in Washington, California, Idaho, and Nevada. We're 30th in the nation in the percent of our population vaccinated at 2.8%. Based on this metric, we're also ahead of all of our surrounding neighbors. I know we all want vaccinations to go faster in Oregon, despite the fact that these data show we're in line with most states and ahead of our neighbors. I want vaccinations to go faster too. At the Oregon Health Authority, just like the federal government and health agencies in nearly every other state, we needed to have been better prepared. We should have recognized that our well-tested and high-performing system for distributing flu vaccines would not translate to the demands of distributing the COVID-19 vaccines. We should have anticipated the unique challenges these new vaccines posed. For example, we needed a better hub system to distribute the vaccines with their ultra-cold storage requirements and time-limited handling demands. We should have anticipated the challenges we'd face in vaccinating the wide range of groups in Phase 1A. We needed to recognize we'd have to work with many sites that had little experience organizing vaccinations. We needed to better provide better training to partners. They needed to know more about what to expect when vaccines arrived so they could more quickly organize their rollouts. They needed to better understand how to log their data so Oregon's numbers weren't artificially depressed by slow data entry, and we could make more informed allocation decisions. But we've adjusted. The reality is that, like the virus itself, the COVID-19 vaccines have presented us with unprecedented difficulties. But in the same way Oregonians are making changes in their lives to keep each other safe, our healthcare and public health systems are adapting to administer vaccines faster and to more people. In the space of a month, we're building new systems for administering vaccines and connecting people to vaccination sites. And Oregon isn't alone. As we climb the state rankings in the pace of distributing the vaccines, it becomes clearer and clearer that other states are struggling in similar ways. But here, the changes we announced last week to speed up the pace of Oregon's COVID-19 vaccination effort has paid off, especially our decisions to simplify the prioritization rules for Phase 1A groups and adjust the supply allocation process to get more doses in hands of vaccinators at sites with the capacity to serve large numbers of people each day. As a result, the number of doses administered per day over the past week more than doubled, and we met Governor Brown's goal to deliver 12,000 doses per day. For example, on Monday, January 4th, when the governor announced her target, Oregon vaccination sites administered 5,142 doses. On Friday, January 8th, after we simplified the prioritization process for people in Phase 1A and delivered more doses to high throughput locations such as Salem Health's clinic at the state fairgrounds, sites administered a total of 12,283 doses. On Tuesday, January 12th, Oregon vaccination sites administered 12,171 doses. On Wednesday the 13th, sites administered 13,100 doses. All these numbers are as of reports received through midnight last night. But let's be clear, the state can't achieve our goal to deliver vaccinations quickly, efficiently, and equitably all on its own. I'm grateful for the hard work that nurses, schedulers, data analysts, and so many other staff in hospitals, local health clinics, tribal health centers, and other sites have put into ramping up vaccinations for Oregon. Where does that leave us? As of today, Oregon's vaccinated close to 40% of the Phase 1A population. By January 25th, we expect to have vaccinated approximately 56% of the people in Phase 1A groups, or 225,000 healthcare workers, first responders, and staff and residents in long-term care facilities, if vaccinations continue at our current rate. By the 30th, we expect to have vaccinated approximately 300,000 people in Phase 1A groups, or 3/4 of people eligible. Now that the actions we've taken have quickened the pace of vaccinations, what's our plan to build on this progress? Between now and January 25th, we'll continue to improve data reporting with ongoing support to local vaccination sites so our data more accurately reflects actual vaccination administration on the ground, and we have more reliable information we can use to make allocation decisions. Second, we'll encourage sites to quickly draw down their remaining inventory of doses on hand. We know sites are catching up on their data. We also know many doses have the name of a healthcare worker, a first responder, or another worker in a phase 1A group on them, but haven't been administered yet due to a range of logistical complexities and simple scheduling issues. We need sites to complete these vaccinations to the full extent possible to lessen the chance of bottlenecks before we move on. Third, we need to prioritize our allocation of vaccine doses to high volume, high throughput sites. Salem Health's vaccine clinic at the State Fairgrounds demonstrated how efficiently high capacity vaccination clinics can immunize large numbers of people. In coming weeks, we're coordinating with hospitals and local public health partners to drive doses to similar large scale vaccination clinics throughout the state. And you'll hear a little bit more about that from Trent Green from Legacy in a moment. And fourth, expand vaccinations to people at highest risk in phase 1A. As we announced last week, we will leverage our partnerships to bring mobile vaccination clinics to homes serving people with intellectual and developmental disabilities, adult foster homes, behavioral health programs, and other group settings that serve vulnerable people. These steps will establish a solid foundation that will enable us to move into the next phase, vaccinating educators as early as January 25th if federal supplies come through. I want to be clear. Oregon had a 12-week plan to vaccinate seniors and educators, but our plan was entirely contingent on receiving the doses of COVID-19 the federal government had promised states. On Tuesday, Secretary Azar pledged to send states, quote, the full reserve of doses available that have been held in physical reserve. If Oregon does not receive those doses, our timeline for quickly vaccinating educators and seniors is in jeopardy because states like Oregon have not been provided adequate supplies of vaccine from the federal government. We must have that surge to supply surge supply that federal officials promised to move forward and immunize educators and seniors from COVID-19. If we receive the promised doses, here's how we would plan to protect educators and seniors. In Oregon, we estimate there are approximately 100,000 educators and other staff who work in childcare, early learning, and K-12 schools. Nearly 800,000 Oregonians are 65 and older. Until we received yesterday's news, Oregon estimated we would get between 135,000 and 225,000 Pfizer and Moderna second doses released from the federal supply. That increased allocation would have increased Oregon's supply from an expected 154,000 doses we knew we'd get next week to approximately 282,000 doses or more in total. With that surge supply and our expected regular allotment of doses in coming weeks, we plan to stage a phased rollout of vaccinations for seniors. Once again, we need to adjust. We know we have far more educators and seniors than we have doses per week. We know that many seniors have been frustrated in other states that have expanded vaccinations to older adults. Here's how we plan to move forward. We will open vaccinations to educators starting January 25th, recognizing that a handful of counties have plans to begin tiptoeing into vaccinating their teachers this week, depending on their supply of vaccine on hand. We hope to vaccinate most educators within 2 weeks, but as always, that entirely depends on the doses we receive from the federal government. Here's how we plan to take an evidence-based approach to vaccinating Oregon seniors. It's consistent with our principle of prioritizing people who are hardest hit and most at risk. We propose to vaccinate seniors in 4 waves if supplies allow. Wave 1 is seniors who are 80 and older. This population represents approximately 30% of COVID-19 deaths in Oregon. This initial wave will be eligible for vaccination starting February 8th. Wave 2 is seniors who are 75 and over, and that wave will follow. Wave 3, seniors who are 70 and over would follow next, and Wave 4 would expand eligibility to all Oregonians 65 and above in the weeks after. While we want to vaccinate seniors as soon as we can, our ability to immunize this vulnerable population depends on getting enough doses from the federal government. We must have the supplies we've been promised. In the meantime, we will do everything we can to make vaccinations easier to get for everyone who's eligible. We'll continue to encourage everyone eligible in phase 1A to get a vaccination as we open vaccinations to educators and seniors. We continue to prioritize our vaccination allocations to high throughput vaccination sites. I appreciate the efforts of hospitals and other partners to organize these efforts. Right now, we have more interest than we have vaccines available. However, all the organizational work underway will help widen the pipeline as we receive additional vaccine supplies. We'll continue to pursue retail pharmacy options for everyone who's eligible for vaccinations. In February, we asked to be included in a federal pharmacy program that will enable eligible Oregonians to go to certain retail pharmacies to obtain a COVID-19 vaccination. These allocations are in addition to Oregon's state allocation. In addition, we'll continue to pursue state-level partnerships to expand the universe of retail pharmacy options for Oregonians. In addition, it's not just important to give people more options to get vaccinated. We want to tell them where, when, and how they can get immunized. Today on our website, covidvaccine.oregon.gov, people will find a new personalized interactive guide that tells you if you're eligible to get a vaccine based on your age and occupation, where you can get a vaccine based on your local county resources, where you can get the facts about vaccines and answers to your vaccination questions. Next week, Oregonians will also be able to call and talk to someone who can answer their questions about eligibility and get directed to local resources. We will have this call center available in coming days before we expand vaccination eligibility to teachers. As we go forward, we'll share information about other tools Oregonians can use to stay informed and receive alerts about their eligibility for a vaccine and where they can go to get immunized. Finally, while there's been a lot of confusion, I want to make this additional point clear. We continue to manage our stocks to ensure that people who receive a first dose have their second dose set aside for them. People should keep that fact in mind when they look at the doses on hand and at vaccination sites. As an example, we're going to receive over 70,000 Moderna second doses next week, and those are for people whose eligibility for a booster dose will occur over the next 3 to 4 weeks. If the guidance we receive from CDC changes, we will let Oregonians know, but so far they continue to recommend 2 doses. Doctors and medical scientists tell us a vaccine is the safest and most effective way to stop the spread of the virus. Once people get vaccinated, we will be free to see our loved ones, celebrate holidays together, get back to normal life. We'll also be free to open businesses and schools again. I want to encourage everyone who's eligible to get immunized. And if you're not eligible, stay informed, get the facts, and get ready. We're doing everything we can to get you vaccinated as soon as we can, as long as we get the vaccines we need to protect Oregonians. In the meantime, keep wearing your mask, keep washing your hands, keep avoiding large gatherings. Thanks, and now Governor Brown, I'll turn it back to you.
Thank you, Director Allen. And with that, I'm going to turn it over to our Adjutant General, Mike Stencil. General Stencil, take it away.
If you can unmute it off your computer again, sir. Tried cycling a couple times. How do you hear me now? All right, thank you. Hello, everyone. Earlier this week, the Oregon National Guard, at the direction of the governor and Oregon Health Authority, was able to offer up our Dalles Readiness Center to the Wasco County for vaccine distribution, as well as utilization as a vaccine clinic. At the same time, we were able to mobilize 64 soldiers and airmen in support of Salem Healthcare down here in Salem over at the fairgrounds and their mass vaccination facility. So our understanding that effort has allowed them to pretty much double their capacity and throughput there, currently looking at around 2,000 vaccinations going through that facility today. We're also working with the OHA and developing plans for long-term health support for other counties here around the state. Part of that includes potential mobile capability, as well as other large mass fixed site distributions as those are developed. With that, I'm going to go ahead and hand it over to Trent Green, the COO for Legacy Health.
Thank you, General Stencil. Good afternoon. My name is Trent Green. I'm the Chief Operating Officer at Legacy Health. The health systems in Oregon have been at the forefront of responding to this pandemic since last March. And for the last 4 weeks, we've made great progress moving as quickly as possible to vaccinate thousands of our frontline healthcare workers, including doctors, nurses, and individuals who work inside of our hospitals, delivering care to our patients. But we know we need to do more to ensure Oregonians are vaccinated as quickly as possible. I think I can say confidently on behalf of my hospital and health system colleagues across the state that we're committed to ensuring Oregonians receive the vaccine safely, quickly, and equitably. Here in the metro area, Legacy Health is proud to join with other healthcare leaders, including Kaiser, OHSU, and Providence, to jointly stand up a large-scale vaccination site at the Oregon Convention Center beginning next Wednesday, January 20th. As we've been doing this as independent organizations over the last month, we've realized that scale is important. And our current independent efforts will not ramp up fast enough to ensure that every Oregonian receives a vaccine in a timely manner. This morning, 77 individuals from across our 4 organizations met in a combined in-person virtual format at the convention center and began outlining plans for how we can safely and effectively deliver vaccines to up to 25,000 Oregonians a day. Based on what we now know, we're going to start with a model that administers 5,000 vaccines a day with a plan to scale to 10, 15, 20, or even 25,000 to the degree that the federal government and the state of Oregon can deliver vaccines. We are eager to partner with the Oregon National Guard on vaccine distribution strategy. It might seem to some that hospitals are not moving fast enough, but as has been mentioned, this vaccine effort is unlike any vaccine administration process we have ever implemented. It's not as simple as duplicating our yearly influenza vaccine campaigns. The COVID-19 vaccine requires special storage, handling, documentation, and monitoring of individuals for 15 to 30 minutes after the vaccine is administered. All the while, we're adhering to appropriate physical distancing requirements. Now, there are still a lot of details to sort out, but on behalf of my hospital and health system colleagues, we ask your patience as we stand up our mass vaccination clinics for our communities across the state. Our aim is to move quickly, but we do not want to repeat what we have seen across the country, where we have seniors waiting in long lines for hours to get vaccinated. When Oregon first administered the COVID-19 vaccines on December 16th, it brought renewed hope to our teams at Legacy Health, and I know to other healthcare providers across the state. There does appear to be a path to getting our kids back in the classroom, giving grandparents the ability to once again hug their grandchildren, and for all of us to gather safely with family and friends. Thank you, Governor Brown, for the opportunity to share how the healthcare community is again rising to the challenge.
Thank you, Trent, and please thank your partners, obviously Legacy Health, Oregon Health Sciences University, Kaiser, and Providence for all of their collaborative, collective efforts to swiftly and safely vaccinate as many Oregonians as possible. And with that, Charles, we're ready for questions.
Thank you, Governor. For our reporters on the line, please use